An international medical conference is set to be held in Adelaide this week, and it's all about how doctors and nurses and specialists communicate with their patients. There's evidence that a good bedside manner can make a big difference in how a patient and their family deal with an illness. And joining us now is one of the conference organisers and senior lecturer in applied linguistics at the University of SA, Dr Jonathan Crichton. Dr Crichton, what started your interest in using your expertise in language to work alongside and support the medical profession?
Well, thanks, Phil. I guess about 15 years ago I began to realise that situations we all experience with medical practitioners of different kinds, have a very high risk of misunderstanding on both sides, and that if you think about it, language, communication is at the centre of this. And, in various specialisations, this is not widely taught. It's not really widely understood, actually. So there's an opportunity there and a need to make things better. And so for about 15 years now, I've been working mainly in psychiatry with psychiatrists and their patients, and more recently we've become involved in aged care, which is obviously a growing area of importance for everyone in Australia, and one in which people are particularly vulnerable and have the potential for getting lost in the system, or not fully understood, and their needs perhaps not noticed. So communication really can make or break the experience of a patient.
Yeah, absolutely. Now, the term a good bedside manner would be the quality that we'd all want in a doctor or a nurse or a specialist. Is that something that can be taught or enhanced in a medical professional?
Well, it's a very good example. I mean, we all remember TV series, where the doctor's got a marvellous bedside manner, and we want to see that with ourselves and all our friends and family. Of course, actually, to accomplish that, it's a lot more complicated than it looks. Like everything, if it's done really well, it looks simple. And so, in a very complex health system, with many different medical specialisations, and every patient being a different person, different risks, different conditions, different diagnoses, prognoses, this gets pretty complicated to achieve that very quickly. But that's exactly right. It's that sense of a good bedside manner, no matter where we are in the health system, that we'd be after.
Yeah. Now, doctors have moments where they probably have to deliver the worst news a person is going to hear. Would it be fair to say that how that diagnosis is delivered can have a profound impact on the way a patient and their family deal with it?
Yep, that's exactly right. In fact, in situations, not just, of course, in the case that you've mentioned, which is one that we all dread and, we want to have happen the best way possible, but in many different health situations, the stakes are really high for people and the risks are great. They can be very vulnerable or lost, moment by moment in the conversation. So when it comes to delivering bad news, which is how we normally understand it, it's actually, again, it's not just a matter of delivering, because it's got to be, it's about how it's understood by the particular person in that moment. And so the skill involved in that, again, is much more challenging to accomplish for the practitioner than simply, as it were, passing on the news in a friendly or polite manner.
Yeah, absolutely. It must be terribly difficult on both sides of that equation. That brings me to the conference that you have at USA coming up this week, in a couple of days. Tell us about that. Is that a way of making sure that even though the terms are becoming more complicated in the medical world, that people can still understand them relatively simply?
That's exactly right. And in fact, we're doing a lot more than that, because in a world in which you've got increasingly complex health systems, risks and so on, the need really is for that kind of expertise to work across all the different health specialisations. And so we've got people from 17 different countries coming, from a whole range of different specialisations in medicine, as well as in applied linguistics and other areas, and people who combine both, actually, these days. And these people are looking to report on and discuss research which aims to basically enhance the patient experience in all sectors.
Yeah, highly important. Dr Jonathan Crichton from UniSA.
Yes.
Thanks so much for coming in
and
telling our story today.
Thanks a lot.
Thank you.